Hello and welcome. In this lecture, we're going to be talking a little bit about emergency preparedness. And really, we're just focusing on a broad sort of overview of the field, particularly in respect to sort of the framework for thinking about it. The reason that we're not going to go into much depth here is we've already actually talked about this a fair bit. When we think about climate adaptation, a lot of what we're talking about is understanding the different types of climate risks that we might face and the disasters that could occur, as well as some of the possible strategies that we can use to decrease the health impact of those disasters. So here we're just going to focus on some of the frameworks for thinking about this, and then we're going to actually go outside of this lecture and look at some of the regional plans that exist for dealing with emergency preparedness and our response in our specific region. So first off, when we think about different types of natural disasters or emergencies that might occur when it comes to health of the population, it's usually best to think of that as a cycle where it's a continuous improvement cycle where we have disasters, but then we recover and we think about how we can do a better job in the future, and that there's this continuous process of learning. So we can think about doing our best based upon what we know about the various different climate risks that are out there to think about what we can do to prevent something from occurring. Now, in some cases, there isn't much that we can do, but in other cases, there are ways that, for example, we could prevent floods by actually redirecting or re-engineering our waterfronts. So there can be prevention measures. And then you can also think about mitigation. So mitigation might be, even if we can't stop something from occurring, what can we do to decrease the negative impact of that event, right? So those are things that we can do far ahead of an event to try and make sure that we can handle it as best as possible. Now, given that we might know that an event is coming, we also want to be prepared. So that can occur far upstream, but it can also mean letting people know that a storm is coming, letting people know so that they can protect themselves and get ready or evacuate in some situations. Then we would think about the response that we have. So we have this event occurring, so we're going to respond in real time to it in terms of allocating resources, bringing in a workforce that can deal with this, and helping the public respond to it as well as is necessary. And then we have the recovery process, which can be a complicated process of cleaning up afterwards, of ensuring safety, of decreasing risk of other antecedent events from occurring, infectious disease or other types of things that might sometimes occur in the wake of a natural disaster. And then we go back through the cycle of recognizing that each of these events will teach us something about how to do something better in the future. So this is kind of how we would think about emergency preparedness in a cyclical and a continuous improvement cycle. Now, when we think about disasters, there's a lot out there in terms of how we handle emergencies. This is some research that's been put together to identify 12 key tasks in response to major disasters based upon our experience with natural disasters. So the first one is really making sure that we have a way to share information among the people who are working and with the public about what's going on. So this is really crucial. These are complex events, and in some cases, there are real challenges to sharing information because it's hard to tell what's going on in multiple locations. There's things like power outages, cell phone outages, other types of communication challenges. So thinking beforehand to prepare to be able to carry out that task is a really important component of public health preparedness and emergency preparedness. Another is managing resources, making sure that you have already the resources that you would need beforehand in terms of being able to have the equipment you need for dealing with rescue operations, the financial resources, the healthcare resources, the other things that you need to actually handle this disaster. All right. So this is another responsibility in terms of preparation for people in these emergency response roles. Another element is if we know that an event is coming, we would really want to issue warnings to the public about what might occur, our level of knowledge about it. And as that event progresses, we want to regularly update the public about what's happening so that they can continue to take measures to protect themselves as the event evolves. Clear communication is really important in this. If we don't have clear communication, you start developing mistrust, or you can have confusion and you can have panic in some situations, in these emergency situations. So having clear, reliable communication is crucial. And it's also important to think about who's going to convey that information, a trusted source, and also to make sure that the communication occurs at a level that everybody can understand it, so that it isn't at such a high level that many people are missing what's being said. So clear, specific communication is crucial in these situations, and regular communication. In the case of a disaster, you'd also want to be able to coordinate the search and rescue operations. So very often that's a real significant challenge. If you have collapsed buildings where you're trying to dig people out, where you have multiple events happening in multiple places, you really have to be able to coordinate to make sure that the right people are in the right place at the right time, and the right equipment is in the right place in the right time. So, and make sure that you're covering the entirety of the places that need the resources, so that certain groups or populations don't get left out of that process. And we've seen that happen in disaster situations. Another thing that is important and tied into the communication element of this is really providing the education that the public needs to deal with the disaster situation. So as I've mentioned, it's not uncommon in natural disasters for as many or more people to die after a disaster than in the disaster itself. So examples of this might be people using generators and dying of carbon monoxide poisoning, right? So you could educate the public about how to properly use generators, right? Or infectious disease is another common thing in certain types of natural disasters. How could you help people to avoid those disease conditions, right? So that type of education, or even educating the public about how to protect themselves in terms of different types of behaviors, in terms of evacuation or other things like that. You also, unfortunately, will need to have a system for triage. So triage is an unfortunate component to these disaster events, where sometimes in situations of limited resources, you have to make decisions about who you give resources to and who you don't give resources to. And sometimes that means just focusing on those who are worse off, and making sure that people who can wait will wait. In other situations, it might be such an extreme situation that sometimes people who are really badly hurt, there's no real possibility of actually helping them and preventing death. So figuring out how to provide comfort to them, but also devote major resources to people who can be helped. So this is a very difficult and ethically challenging situation for emergency responders and healthcare workers. Another major consideration for these disasters is, how do you distribute people who've been harmed to the right locations? So it's not uncommon that if this planning hasn't been done right, that you can have too many people going to one hospital and you can have another hospital 10 miles down the road that is sitting empty, right? So having a plan in place to make sure, and people who are managing this to make sure that you're equally distributing people among different locations to ensure that they have the best quality care is really important. Another issue that sometimes is a problem, often is a problem in natural disasters, is actually tracking patients or survivors of a storm to make sure that where they are and make sure that they have the resources that they need. For example, after Hurricane Katrina, people evacuated to all sorts of different places and families were split up and they couldn't find each other. So having systems for tracking people and connecting people is really important for success after this event. You also want to think about having backup healthcare resources. So one, as you're preparing, you want to have those resources be put in place, but also as you're dealing with a disaster, trying to assemble the items that you need is really important as well. And this relates to the next point, which is the need for managing volunteers and the donations that you request. So this can actually be quite complicated. In natural disasters, people understandably want to help out, but unfortunately, in some cases, you get a lot of volunteers who just show up at these these disasters, but who may not have the training or may not be integrated into the system that's being implemented. And sometimes they can actually detract from the response. They also sometimes take up needed needed food resources or shelter resources, right? And sometimes that can actually be a burden. So having a system for dealing with volunteers, bringing the volunteers you need, and training them and integrating them is an important thing to consider in these situations. And then also disasters. In disasters, you want to have some way of managing the donations that you get in response to it. So in some cases, the most important thing might be to get blankets. In other cases, you might need a food source. If you're in a really cold location, the blankets might be the most important thing. If you're in a place where there's food insecurity, the food might be the most important thing. And figuring out what those needs are and having those donations match those needs is an important process for this response system. And then finally, it's really important to expect the unexpected. As much planning as one might do, as much as you might think about this, there are always surprising things that happen. So you respond to the disaster and suddenly there's an outbreak of a disease that you didn't expect, right? So these types of things happen all the time, and having a flexible and agile system in place to deal with those things as they come up is important. And to just expect that there will be things that you didn't plan for is important for effectively dealing with these situations. So these are just some tasks and thoughts about how one would respond to these complex situations. And this will look somewhat differently in different types of disasters, but they are sort of general things to consider in terms of setting up a disaster response system that is more likely to be effective. Now, I think there's a lot of different things to consider when it comes to emergency preparedness and disaster response. I think it's kind of helpful to think about our region and what's going on here. So I'm actually going to refer you to online resources to actually look at what types of tools, resources, and strategies are already in place for our region. So I think that would be interesting to you, and it's kind of useful to go through that yourself and think about some of those things. So this is just a general overview. I hope it is interesting, helpful. Some things to think about as we design a disaster response system. Again, thinking about this as a continual improvement cycle. And then secondly, thinking about some of the complexities of trying to respond to disasters as they occur. All right, so thank you very much for listening. Take care and be well.